Stop. Welcome to Brain Chat. I'm Dr. Mitzi Joy Williams, your board-certified neurologist and MS specialist, and my mission is to engage, educate, and empower those affected by MS to become an active part of their healthcare team. Here on Brain Chat, we'll be discussing all things MS, health and wellness, advocacy, and we'll even throw a little bit of music and music therapy in there as well. Thank you so much for joining us, and stay tuned for the next episode. Hello, and welcome to Brain Chat. Happy Monday, everybody. It's Dr. Mitzi, the nerdy neurologist. I am so excited to be here with you guys to talk about a topic that I think is very important, and that is spasticity. But before we get started, you know how we do on Brain Chat. Type in the chat and let me know where you are logging in from, where you're viewing us from. I bid you greetings from the lovely Atlanta, Georgia, where it is a scorcher, as it has been every day this summer. So it's 90-something degrees. It's super hot, but fortunately, I'm grateful for air conditioning. So here we go. So anyway, I'm so excited about tonight's episode. And I know I say that every Monday, but I'm really, really excited to be talking about a topic that I think is very relevant. We're in our symptom management series where we're trying to cover, things that affect people on a daily basis. So we've talked about imbalance, we've talked about fatigue, and tonight we're going to talk about spasticity. We're going to talk about what it is, we're going to talk about how to treat it, and we're going to talk about what you can do about it to help hopefully decrease some of those symptoms and help prevent it. I see a couple people logging in, someone logging in from Chicago, someone from LA. I love it. Greenville, South Carolina. And so you guys keep typing in the chat, and I will bring up our wonderful guests. First, we have Dr. Mary Hughes, who is a great friend and mentor, and she is the medical director of Premier Neurology in Greenville, South Carolina. She's an MS expert as well as a spasticity expert. I learned everything that I know from her, and I'm so excited to have her on Brain Chat tonight. Welcome, Dr. Hughes. And we also have Dr. Jackie Nicholas, who's an amazing MS expert at Ohio Health. And she is also a spasticity expert. And we are going to have an awesome conversation tonight. So let me bring up my wonderful guests. Welcome to Brain Chat, ladies.
Thank you for having us.
Thank you.
Thank you. All right. Thank you guys so much for coming. And I am super duper excited about our topic tonight. I see a couple people typing in where they're from: Indianapolis, New York, Philly in the house. Okay. So we got folks from all over the US. And I thank everyone for taking out their Monday night. And I thank you all as well for taking out your Monday night to come on Brain Chat and to talk about spasticity. So why don't we start with Dr. Hughes? So tell us a little bit about yourself and how you got into MS and your interest in spasticity.
Yeah, so thank you, Mitzi, for having me. I actually got interested in MS probably about 5 minutes after my sister got diagnosed. And that was over 20 years ago. And so we didn't know much. I think it was kind of a couple pages in the textbook. And we knew a lot about how to diagnose it, or at least we still struggle with that. But as I got more interested in MS, what I really realized is that we certainly want a cure, but people have to live with it every day. And so the better we can do about managing the symptoms related to MS. Spasticity is a great topic for us because while 70% of people with MS have it, probably 90% of people don't know they have it. And physicians don't know, therapists don't necessarily know about it. And so forums like this really help us get the information out.
Awesome. And Jackie, Dr. Nicholas, tell us a little bit about your interest in MS and your interest in spasticity.
Yeah, well, thanks again for having me join you guys tonight. So I was in my residency training in neurology, and my very first rotation was in a large outpatient multiple sclerosis center. And I just absolutely fell in love with caring for MS patients from day one. I think it was really my mentor, because he was such an excellent MS doctor and really listened to his patients. And I realized that there were so many things that we could do for all of the symptoms that they had. And so I was just really excited about that, because it wasn't until I had that experience that I knew there was a lot we could do to help folks with MS. And spasticity, one of the things that it was actually the symptom I was most frustrated with, because in general neurology residency, most of the time we just learn about pills to help relax muscles. And a lot of my patients had trouble tolerating them, and, still had a lot of pain from their spasticity or limitations and how they could get around. And so I was lucky enough to meet a PM&R doctor early in my MS fellowship, who said, yeah, come spend time with me. So I spent a year with him learning how to do things like Botox and Baclofen pumps. And really it was exciting, because I would see people come in and receive these treatments and then come back and feel so much better. And I think in MS, we see the benefits of what we've done over decades. And then in spasticity, it was nice to see some quicker improvements and to have people feeling better. So that got me hooked.
Yeah, I mean, and I think, both of what both of you said is so, amazing and true. I obviously got to work with Dr. Hughes in residency and fellowship, and she had a large spasticity clinic. And so that introduced me to spasticity. And we treated people not only with MS, but with other conditions like cerebral palsy, stroke, so we got to see a broad spectrum of different presentations of it. But as you said, it's really about quality of life, right? We've come a long way with our disease modifying therapies. We know that there are some things that we can prevent, hopefully with disability and progression, but we also want to affect how people feel on a day-to-day basis. And so spasticity is one of those symptoms that can really, make or break somebody's ability to function. So let's take a step back and let's talk about what is spasticity. So people kind of give me all kinds of descriptions, like it's like a muscle, it's like a rubber band, it's like a jerking, so what is spasticity? What does that mean? Because Dr. Hughes, you said that a lot of people have it and don't know they have it. So how do you know you have spasticity?
Well, the answer to what all your descriptions is yes. In 2010, I had the pleasure of moderating a consensus panel on spasticity. And we wrote a paper out of it. And the first 7 pages were dedicated to how do people experience it. And it was all of what you said. Some people say it's a tightness, it's a squeezing. Some people say it's a stiffness. People may say pain in their joints because the muscles are pulling across them. A lot of times, unfortunately, it's worse at night and early in the morning. So when you examine someone in the middle of the day, you might not see it. And if you don't see it, and signs of it may be really brisk reflexes, we actually don't do as much of what I like to say is wiggling the leg, just moving the arm and leg back. And if you are struggling, then probably the patient is struggling on the other side of that. So asking those questions, do you have trouble sleeping at night? A lot of restless legs in people living with MS may not be restless legs. It may actually spasticity. Maybe in the evenings when they sit down to watch the news and the legs start to jump or they're twitchy. And so it is experienced in a lot of different ways. What is it? Anytime there's an injury to the brain or the spinal cord, spasticity is a long-term consequence. We know, for example, people have a stroke. Right when the time they have a stroke, they may not have any increased tone, but we've all seen people who had a stroke years ago, and we see their arm is kind of brought up. All right, that's one manifestation of spasticity. Jackie, I'm gonna let you take the hard part. What causes it? What's it? The nerves and the muscles. I usually just say is they're fighting each other. One is more active when the other one should be relaxing. And what happens is you're working harder than you really should be to move that extremity.
Yeah, so that's absolutely how I explain it. I think that, the important thing, especially when we're talking about MS, is that, any lesion that you have in the brain or the spinal cord, the central nervous system, can trigger spasticity. And I think one of the most confusing things for patients and even some healthcare providers is that I've had people where they haven't had any new damage in their brain or their spinal cord, as far as we can tell by MRI, but they didn't have spasticity before, and then they start to develop it. And so sometimes people worry that they're having a relapse when it starts, or that something new has happened. But really, it's just a manifestation of that old damage, that at some point we're really just kind of losing that inhibitory control. And you're absolutely right. Muscles that should be relaxing are contracting. And especially when you're trying to do something, if the opposite muscle is fighting it, that makes it really challenging. And yeah, a lot of my patients describe it happening at nighttime. And that's a really important place where we have a lot of things we can do to just help people feel better and sleep better. And I think one of the most, interesting things that it takes a while to learn when you experience spasticity is that your body does not like to be annoyed by any annoying stimulus. And so if it's cold outside, like here in Columbus, we have a lot of cold weather. People are calling me and saying, oh my gosh, like my leg's locking up when I try to walk, or, my foot's turning in. But then we may find that as it gets warmer, like it is in the summer months, people say, well, it's not bothering me as much. So I think we try to, really educate that sometimes an increase in spasticity could be a sign that there's something going on with your body. You might have a urinary tract infection, or you might have a wound somewhere. And so it's a tricky symptom, and it can change so much over time.
Yeah, one of the things that I'd say when I'm educating my patients about spasticity is that it is a super sensitive symptom. If it's too cold, it gets worse. If it's too hot, it gets worse. If your clothes are too tight, it gets worse. If you sit too long, if you stand too long, so often these kind of extremes of activity, extremes of temperature, many different things can affect it. And as you said, infections as well, so it's one of those symptoms where, as you said, Dr. Nicholas, I don't necessarily look at it as a relapse every time spasticity gets worse. I'm often looking for something else going on under the surface, that may be causing it to suddenly worsen. And I think another thing that's really important to bring out is that spasticity is painful, and there was a time in MS where we said MS didn't cause pain, right? And now we know very much that that's not true, that there are a variety of types of pain. People can have nerve pain, but spasticity is a very common type of pain that people have. And it's important that they talk to their healthcare team about, that pain, so that it can be treated appropriately. So we talked about kind of what it is, the variety of symptoms, tightness. Sometimes it can feel like joint pain, sometimes soreness. People will tell me it feels like they worked out, but they didn't really work out, so lots of different manifestations. We talk kind of about what causes it, but let's switch gears a little bit and talk about, so what do we do about it, right? What are some of the ways that we can treat spasticity? Let's start with, medications, and then let's work our way also to more either procedural based or either natural things that people can do.
So we got to start with the S word. Stretching.
Okay, well then let's start that way. Let's start with what you can do, and then we'll talk about the other medical stuff.
So, we counsel our patients with MS to start exercising if they're not already exercising. And usually I'm a hypocrite on this, and I'm not necessarily, but we need to exercise, right? And one of the things we focus on from the very beginning is stretching, right? Keeping those muscles limber. And a lot of times when I meet somebody with really milder spasticity, we try to manage that with a stretching regimen. Yoga is fabulous. Pilates is fabulous. Tai Chi is fabulous. And this isn't the 2-minute stretch you did in high school before you went for a run, right? You just kind of threw a leg up. You did. This is really a focused stretching regimen. And I actually send people to the internet all the time. There's some fabulous YouTube videos on how to stretch or yoga. So I always really encourage people to start there. And even if the medications are needed, you can always tell the difference between somebody who is stretching and exercising and someone who doesn't. That said, I agree. Majority of people are going to need to complement their exercise regimen with medications.
Mm-hmm.
The medicines haven't changed much.
They
The
have not.
primary ones are baclofen and tizanidine. Interesting, there's some medicines we think about for muscles like flexural doesn't really do anything for spasticity. It's a different mechanism. There's been some extended release. The key with starting those medicines is you have to start really low and you have to increase it really slowly. And I meet people all the time who say, I tried it and it made me tired and I'll never try it again. Or I couldn't think straight. And we say, let's try it again, but let's go really low, really slow.
Mm-hmm.
And those are the primary ones. Are we going to get into some of the things that are being studied in research? We'll skip that.
Yes. Yeah, we're going to go with standard, then we'll go to what's on the horizon. Anything you want to add to that, Jackie?
Yeah, so absolutely. Those are the two most common oral pills that we use in spasticity. Interestingly, there is some data for one of the nerve pain medications that we use, gabapentin, for spasticity. So sometimes we get a little benefit from that, but I agree that wouldn't be my starting point. But sometimes if somebody has really mild spasticity and nerve pain, we might be able to manage it with that. Stretching, absolutely 100% is a discussion from day one. And then when people have spasticity that is more severe or doesn't respond to the oral medications, that's when we start looking at more advanced options. So one of the more common options would be using botulinum toxin, so Botox. I remember the first time I told my mom that I was going to learn to inject Botox, she said, what's a brain doctor doing injecting Botox? Because she thought it was only for wrinkles, but you don't want a neurologist injecting you for that.
Absolutely not. Absolutely not.
People try to convince me of that. I'm like, no.
Yeah.
But the Botox is a medication that can be injected through the skin with a needle into the muscle that's stiff. And so it has to be injected into the particular muscles that are most bothersome or that are impairing mobility or causing pain. And it's really an art. So, and requires a lot of skill to do. So, nowadays, I think almost anybody can inject Botox, but when you're doing it for muscles, you want to be very careful because Botox, although it loosens muscles, if somebody gives you too much or not in the right place, you could end up having some more weakness than you'd like to see. And Botox will last for about 3 months. So we always want to start low and then gradually increase based on each patient's response. So I always tell my patients, you're probably going to be more disappointed with me the first time than the second and the third time because we're going to adjust it based on you. And if we don't get it completely perfect the first time, that just tells us we need to increase. And I'd far rather that than somebody calling me and saying, thanks a lot, I'm weak now, and this is going to last for 3 months. So Botox is really important. There are different kinds of Botox. So, your doctor may help you figure out which one is best for you. Or if you stop responding to one, you may switch to another toxin. And then for more advanced spasticity, if somebody has more generalized spasticity or maybe they're getting Botox and they're requiring a lot of Botox and it's just not safe to give more or it's not going to be approved by insurance, we consider things like an intrathecal Baclofen pump, which basically that intrathecal word means liquid Baclofen being delivered into the spinal fluid. And so basically the way we assess for that is not to send somebody off for surgery to get a pump placed,
Right.
but to do a test dose where we will do a spinal tap, just like many people had at the time of their MS diagnosis. But instead of taking fluid, we'll inject in that liquid Baclofen and then take the needle out and have somebody spend the day with us in the MS center. And we will reevaluate them every hour and see if they've had improvement in loosening of muscles. And really the big question to answer is yes or no, did you get looser? And if somebody feels, if we're noticing that they did improve in terms of their muscle stiffness and they were looser, then it just means that it's an option. And so that pump is something that needs to be surgically implanted. And then there's a tiny tube that goes into the spinal fluid to continuously deliver liquid baclofen. And many people say, well, why would I want that? I didn't benefit from oral baclofen. Well, the reason is we're really we're bathing that spinal cord and brain with the spinal fluid that contains the liquid baclofen. And so we're targeting it exactly where we need it. So we use very tiny doses to cause a big effect. And so it's, it's helpful that it's not typically something that makes people feel tired, but has a major impact. But it really helps the legs a lot more than the arms. So sometimes people that have a pump might still need Botox injections if they have arm spasticity or maybe some pesky muscles that don't respond too well. But the nice thing is there's just lots of options. And I think it's really based on the individual patient.
I've said I'm going to get me a t-shirt that says, "Love me some spasticity." When a patient comes in and they're saying they're having more trouble walking or they're in a lot of pain, I love me some spasticity because there is such a wide treatment of it. And there's so many things that we can do to make such an improvement in quality of life, and that things we can do in the short term that really have a big impact. And the sad thing is so few people know about it.
Absolutely.
I was guilty. The first patient I met with an intrathecal baclofen pump, I was in the room and I just kept hearing some beeping sounds. And I finally figured out it was coming from the patient. And she's the one that told me I have a pump, but it needs to be refilled. I said, "I'll be right back." Right back. Like, does anybody know about what kind of pump she has?
Right.
But it's really remarkable in the right patient. And so,
And so what I'm hearing here is that, there are often multiple ways that we treat it, and we often need combinations of therapy, right? So it may not be just one answer in that one person. Obviously, there's a part they play. My favorite Dr. Mitziism: there's a part you play, there's a part medicine plays. No medicine is going to get rid of the part that you play in your own health. So you got to stretch, you got to get that exercise in, right, to the best of your ability. But when it comes to medication, sometimes it may be a combination of medications. Sometimes it could be some Botox plus medications. And when we talk about Botox, I tend to think of Botox as something that's, as you said, Jackie, very targeted, right? So if someone has a hand that's cramped and we're trying to clean that, we can kind of open up that hand. But we can't give Botox all over your whole body every 3 months, right? So that, so that's for something very targeted and specific, but we often have to incorporate other things, to also treat the overall spasticity. And even when it comes to an intrathecal baclofen pump, if that's where someone needs to go. And Dr. Hughes and I were having an interesting conversation about, she did the consensus statement in 2010, and we still don't know when to implant pumps, right? So traditionally people have gotten pumps kind of when they're not very mobile and they're really spastic and tight, and maybe people need help picking them up out of their wheelchairs and transferring them. But should we be thinking about them earlier on when people are walking to prevent them maybe from getting in that wheelchair where they're very spastic and tight? And I don't think we know the answer to that, but certainly there are some things that we still are thinking about, even all this time later. Any thoughts that you guys have about that?
I laughed. The article we wrote was called "Too Little, Too Late," intrathecal baclofen. And the whole concept is, as the technology has been around for 20 years, this is not new technology. And it's really the expertise in knowing how to manage it and identify people early. And so when you think about people who are, in their prime working years, and they're taking medications that make them sleepy and may slow them down, and yet they're having trouble getting around because of their tightness in their legs and their spasticity. Well, that may be a perfect time. We never go straight to a pump. I'm not at all saying first thing we do is we put in a pump. But I've had more people who have been through and kind of look at me afterwards as, "What took you so long?" Right? And I'm like, well, we had to talk about it. And we had, so it's something to know about. And it's something that if you've been discouraged, you've tried the pills, and you didn't, the conversation should not be over. And that there are other options out there for you. And I think that's really the key point.
And then the other piece is there a time when spasticity is good? right? So one of the, dangers or concern, I won't say dangers, but one of the concerns with pumps, and I've seen this with some patients, is that you can make people too loose, right? And if people have weakness and they have spasticity, sometimes completely removing that spasticity will make them so weak that they can't stand up. So in some cases, we need a little bit of that spasticity to be able to stand and move around, and if we take too much of it away, it can actually make people less mobile.
Floppy babies don't crawl, right?
Right.
So we've all heard of floppy babies. They don't have enough tone, and it takes longer for them to crawl and walk. And it's not just the pumps. I've seen people come in with really high doses of the medication,
Yes.
and they're
absolutely.
not doing well, and they're spasticities. And really, what the problem is they are too low tone and hypotonic, and we need to wean back that medication. So it is this real balancing act about you need tone in your arms and legs, but you don't need too much.
Right.
I think it's exactly right. I early on in my career, I did a study on our MS patients who had received Baclofen pumps and presented that data at one of our European MS meetings, ECTRIMS. And I had a couple of neurologists come up to me and say, "Oh, I don't do pumps because if you give someone with MS a pump, they won't walk anymore." And my poster had all the outcomes on it of all the people that were still walking. And so it's true that if you give them too high of a dose and you take away that spasticity, they're not going to walk. But if you manage it to where you're getting a fine balance between loosening of the muscles and comfort and mobility, along with enough of the stiffness to maintain mobility, it's not, that's not necessarily going to happen. So I think it's just an education piece. And again, it's fascinating to me how long the pumps have been out, but how few neurologists really know much about it.
And I think people are using them less and less, when I talk to people. So it's certainly, for, those who are listening, something to, kind of put in your mind if you've tried multiple options, and talk to your doctor about it, because there are some people who do really, really well with the pumps. And, as Dr. Hughes said, it doesn't make you as sleepy, so people can kind of function, normally in other respects, but still have that spasticity and that tightness in their muscles treated. So thinking about research and thinking about kind of the next generation of things to do, because I think the cool thing about being an MS expert at this point in time is that so much has changed in such a, short period of time. I always feel like we're on the cutting edge of medicine. That's one of the reasons I chose neurology and chose MS, because everything wasn't figured out down to the receptor. There's lots of room for discovery, so we've seen so many things change. What is the next step, or what are the things that are on the horizon and really being studied in the field of spasticity and treating it, right? So we've had these same medications we've been using for a long time. Everybody's got their 2 or 3 in their arsenal. We've got certain procedures. Botox has been around for a while. The pumps have been around for a long time. So what's next, or what else can people look forward to in terms of the research and other things, that can help address this symptom for people living with MS?
Well, we're going to bring up the M word. And is marijuana or THC good for spasticity? And actually, I would say this is one of the few areas that there is actually pretty good science that it may help. So we all go to the same meetings, and there are things that are studied way before in other countries than there are here. So I can remember going to an 8-hour, I didn't even know there was enough to talk about for 8 hours, seminar on THC and spasticity.
And what is THC?
THC is the active ingredient in marijuana, cannabis. And what I took away from that conference, to be quite honest, was that if you examine someone before and after they have taken some form of THC, right, the active ingredient, you may not be able to tell a difference in their exam, but they feel better. Now, when we're talking about quality of life, that may actually mean something, right? We take pain medicines because we want to take the pain away. That doesn't necessarily mean that the broken arm is no longer broken, right? But if you can take away some of the things that are making people feel better, perhaps they'll exercise better. Maybe they can participate better in physical therapy. So is there a role for that? And in the last couple of years, there's been a pretty concerted effort to study cannabinoid agents here in the United States. And so I know we've been trying to get a couple studies up and going. The ironies of telling my son he should not be smoking, and I now have my special license to study THC and its derivatives. It does make for interesting dinner conversations.
I could imagine.
So can we look at, it's a very controversial conversation, particularly here in South Carolina, where it is not legal. But medical marijuana, medical cannabis, and the idea being, can we take out the fun stuff, right? The psychoactive, and leave the beneficial part of it, and see an improvement in people's spasticity. So I think that's going to be the hot next topic, and hopefully the next year or so we will see. I would have said last year, but it keeps kind of there's a lot of regulations involved in trying to get involved with research in this area, but that is the next topic from my standpoint, and in spasticity, in the symptomatic treatment. And I almost feel like we've been so excited at about all the options we have now to change the course of MS. Mm-hmm. We kind of forgot about the fact that we still need to take care of people who have MS. And how do we treat what's been left behind by the fact that they've had MS? So,
that's right. Yeah, it's such a big topic, and I think that our people with MS are craving more information on this, and I think they've even gone ahead of the field and are really doing the experimentation on their own, because we've fallen behind with all the regulations, not being able to study it. And so I think it's been challenging from a medical standpoint, because we want our patients to feel better. But we also want well-designed studies where we can explain to somebody, what is the dose that I should take, or what are the side effects? And so in the state of Ohio, people can obtain a medical marijuana card from a healthcare provider who is a medical marijuana recommender. And then they can go to a dispensary and really purchase anything. But what patients have shared with me is it's really confusing, and there are a lot of different options, and they don't really know what to do. And so they try something and they don't like it, and so they don't know whether to go back and do it again, and it can be costly. But I think what's kind of exciting, again, along the same lines in research, there is a compound that has been available over in Europe to treat spasticity for quite some time, and it's called Nobiximals. And this is an oral mucosal spray that has shown benefit in spasticity reduction in individuals with MS. And we've presented a lot more data this year at ECTRIMS and CMSC and the AAN meeting. And so kind of, renewing that interest. And my hope is that ultimately this may be available in the United States. And that would be quite wonderful, because really from the data that we have, it's, taking away what I thought that was really fun to see.
The fun stuff.
What you think of in college of, oh, this person's a pothead. That's not our goal in treating spasticity, but we really want to be able to minimize those symptoms, but allow you to be still there and fully present in your cognition so that you can take care of your families or do your job, but have a reduction in that spasticity. So some of the data really shows pretty minimal impact on cognition and reaction time and all of that. So I agree. That's what I'm the most excited about in spasticity, is really to learn more about, how our patients can take it into their own hands. Having an oral mucosal spray, that's pretty quick acting, a lot better than, when I'm like, oh, swallow a Baclofen and it'll kick in an hour. So hopefully we'll see more and more of that.
Yeah, I think it's very exciting, and I do a show about THC every year, and I've got one coming up probably later in September. And I think it's fascinating how the thought process has changed. I certainly was like an old school, like people just want to get high, but as you said, Jackie, my patients started kind of experimenting themselves, and I saw people, some of them coming off of other medications, much better quality of life, able to get around and do things, and so, you know, I began to see in my own little group that, there are certainly benefits for some people. And so if we can take the medically, beneficial part of that and isolate it and people use it on a regular basis, I think it really does improve quality of life for many people. But I also think there's a lot of work that needs to be done in making sure that people know the difference between the products. Some people will go to a dispensary and have really knowledgeable people, who can help them navigate. And in other cases, they may go to the CBD store down the street, and I don't know what's in that, stuff that's in the store. So I think there's a lot of work that needs to be done in terms of standardization, so that people make sure they're getting the right thing that it is, and that it is helping. Any other, thoughts about, or has anybody had patients use things like biofeedback or acupuncture? So I also talk a lot about complementary medicine.
Mhm.
So have a lot of folks that do biofeedback, acupuncture, etc., with some, kind of variable results. But do you all have any experience with people using those types of modalities to treat spasticity?
So, I mean, I do refer to acupuncturists, and I think it's like anything else. Some meds work for some people, some meds don't. It also depends on the skill of your practitioner. Reiki, I'm never sure if I'm saying that right, is a form of complementary therapy that has been suggested to be helpful. Rolfing, or very deep tissue massage, is another one that I don't think I could ever make it through a Rolfing session, but for those who can survive it, because it can be very uncomfortable, and I'm a bit of a wuss. But the is another alternative therapy that can be, but I don't know that I consider yoga, Pilates, all of those modalities that are part of it. I just want to say, I think one of the best quotes I ever heard is, "You don't get your medicines, you don't get advice about your meds from behind the gas station," right? And so, studying all of this um, in control, so we can really give and make sure that what you're getting is the same every time you're getting it. It doesn't have anything extra in it. So it's a very, I know, I think in the field of MS, that people are very receptive. There was data that 80% of people with MS had tried or currently were using an alternative or complementary treatment. And the real need is for us as healthcare providers to get on board and to learn.
Right.
Eastern medicine's been around for how many thousands of years? And it's there for a reason.
Right.
And just because I don't know about it doesn't mean it doesn't work.
Absolutely.
I agree with that. And I think that one of the things I find is that, unfortunately, a lot of these alternative treatments aren't paid for by insurance for most folks. And that's the reason I know that they work, because my patients will keep paying for them. And so, it says a lot that they're paying out of pocket for some of these treatments. But yeah, I would say massage is one of the most effective treatments in my patients. But one of the things that they mention is, I feel really great that day, but then it often feels like it's back. But for folks who can fit that in, sometimes that is covered by insurance and can be incredible.
And one other thing that I would add as we're kind of coming to a close is that I am a big advocate of mindfulness. And so I think that mindfulness is extremely important, because oftentimes people will have a medical condition like MS and have spasticity related to that, but also chronic stress can cause a lot of tension, which can worsen that spasticity. And so the reason I think mindfulness and yoga kind of fits into that as well is extremely important, is because you recognize where your body is in space, right? You recognize those parts of your body that you're tensing up, And I always tell the story about when I first started doing doing yoga maybe 20, 25 years ago, I was in class and the teacher would be like, get your shoulders out of your ears. And then I put them down. And then 2 minutes later, she'd come back and say, get your shoulders out of your ears. And so I didn't realize I was walking around all the time like this. And of course, I'm exaggerating, but oftentimes we're holding that tension and that stress in different parts of our body. And then you've got a condition that causes muscle tension on top of that. You can find yourself in a really bad pickle trying to get rid of that pain, and if you can at least kind of work on one piece of that, the chronic tension and stress part, it might lessen some of those symptoms and keep them from compounding on each other. So with that being said, this has been an amazing conversation. I thank you all so much for your time and expertise. I think people got a lot out of it. I see so many comments in the chat where people are saying, different things that help them, water aerobics. Someone else was talking about THC. Someone said something about cupping, which is something that I need to learn about. I certainly have had some folks who've experienced that, but there's so much that we still have to learn. And being an MS doctor often is a very humbling experience. I learn something new every day, and I think ultimately what we want to do is improve people's quality of life, certainly in the long term, but also on a day-to-day basis. So are there any parting thoughts that you all have before we close out the show today?
So I'm feeling we need to confess. What were we talking about before the meeting started? Was Tiger Balm.
Tiger Balm. I forgot about Tiger Balm. Tiger Balm is my jam.
You were telling us about when your neck gets tight, you put Tiger Balm in. And so I'm like, what? How do you spell that? No, Tiger Balm. It was the more sophisticated yoga balm, I think, that you didn't know.
Yes.
So there are a lot of things that can be done and that we have to be receptive to and to try. And so, but I think the first thing, and here's the challenge, is people don't know they have spasticity. And so if you don't identify what the challenge is, then you're never going to come up with a good solution for it. And so hopefully your listeners who not sure if they have spasticity or not sure if it's being well managed will challenge your practitioners. And if they have to do like I did with the first pump, run out the door and go, does anybody know about this? That's okay. All right. That's okay. And a good thing sometimes.
Yeah,
Absolutely.
I couldn't agree more. I think that's key, just knowing what it is. And if you think you have it, bring it up and then stretch. And if what you're being treated with for spasticity isn't working, really ask your healthcare provider. There are so many options and so many people out there to help. And one thing we didn't mention is the importance of physical therapy and occupational therapy.
Yes.
In our fight against spasticity. They are key players, and they do so much for my patients in terms of stretching. And sometimes people need certain types of splints or braces to help stretch muscles. So that's something too that we really refer and involve in spasticity care to them.
Absolutely. Well, it has been amazing. Thank everyone for tuning in to Brain Chat. We will see you in 2 weeks, same bat time, same bat channel. Thank you to our sponsors, Biogen IDEC and Janssen, for sponsoring Brain Chat. And we will see you guys in 2 weeks. Thank you.
Thank you for having us, Mitzi.
And good night.